The Rugby League immortal Wally Lewis is calling on the government to fund an education campaign so school children can learn about the dangers of concussion. The Maroons grade has been diagnosed with probable CTE, a form of dementia from multiple head knocks from his playing days. Joining us live with more is Neurologist Dr Rowena Mobbs. Dr Mobbs, really appreciate you making the time for us. Thank you so much. Around the country, as we know, parents are gearing up for the upcoming winter sports season. It will be kicking off in the coming weeks. What advice do you have to parents or grandparents perhaps listening to you today who are seeing what are quite alarming headlines around CTE and sport and who might be worried that they could be potentially exposing their kids to this?
Well, it was a quite momentous occasion having the King address the National Press Club, none other than Wally Lewis, leading the charge, a real champion off the field as well as on the field, you know, talking about CTE and saying that it's okay, A, to talk about it, but B, we have a plan in place. And I think that the government now need to step up and provide this $18 million worth of funding to ensure that our children have opportunities for safer sport, but improved sport opportunities for life. We want children especially to feel that they can participate in sport. It's got so many benefits, but it needs to be done in a safer way, and that's what Wally's calling for.
And as a neurologist, how do you think that we can make these sports safer?
Well, there are several ways. Firstly, the rules have tightened up in sports like rugby league, rugby union, AFL, for example. But across the board in sports, we now have the AIS protocol standing strong at minimum 21 days rest for the community after concussion. But there are different ways of reducing head injury burden in training, less contact sessions in training, less games overall that our kids are being exposed to, and looking at what is that safe age to learn how to tackle, but delay that as late as possible. Plus awareness on brain health. So part of the initiative is educating our kids in schools through sport with the leadership of people like Wally to say, how can we reduce head injury and how can you look after your brain for life?
Yeah, and good on Wally for making this such an issue and speaking out himself. I've had him on the program and he certainly makes a compelling argument. There's no doubt about that. What would you say to viewers who might be recalling a time when they themselves have suffered a bad head knock, possibly back in their younger days on the footy field or similar? Who should actually be getting testing for CTE done, and what does that process even involve?
Well, anyone who is concerned should be talking to their doctor firstly. The people who should be considering their risk of CTE are those who have played at least 10 years of contact collision sport at the higher level or had other repeated head injury exposure to not only concussion but the hidden subconcussion injuries to the brain, those without symptoms. And Wally certainly describes others reaching out to him, and I think it's okay now that people come forward and talk about this and say, what is my risk here? Go talk to their doctors and they can appropriately get assessment and then care and monitoring over time for what is a very slow type of dementia. CTE can occur over decades rather than years. And simply being aware of the possible symptoms like memory loss, language changes, mood changes in particular, easy anger that can occur or anxiety and depression, being aware of these factors worsening over time is a trigger for people to then need to go and see their doctors and get some help.
As I understand it, CTE can't be reversed, but it can be treated. What is the sort of treatment available to people who are suffering from this?
There are a myriad of ways that we can help people with CTE. Like all forms of dementia, we cannot cure it, but we can try to keep people's brains healthy in other ways, address other medical conditions, for example. We can also target those memory and mood symptoms, the anger tendency that people have with medication and also non-medication strategies. And simply validating people, allowing them to come forward for care, be heard, be understood more and be monitored over time. That's proving to be a powerful force and play a really good role in the health of these former players who are affected by probable CTE or those even at risk of CTE. And so through this call for federal funding, we're asking for Concussion Connect programs networked around the country to help care for those with CTE and provide those avenues of obtaining care and support.